The Red Cross out front has a cute little paw in the middle.
Do we have a heart rate?
But there's nothing cuddly about what's happening
Atropine.
right now.
Pam, I need you to call this owner. Yes. Let her know we've gone into cardiac arrest. We're performing CPR.
This is Tulsa's only 24-hour emergency room for animals, where patients range from the cradle.
She's been pretty good since we got her out of there.
As an exhausted mama gets a quick fix of calcium.
Her body cannot keep up with the demands of nursing.
To the grave, as Betty Rogers is consoled by a doctor after losing her 12-year-old dog, Miracle, to natural causes.
Every time I looked at her, I felt the love of God.
It's that kind of a connection
I hear ya, cutie.
that has inspired many of the people who work here.
I've always felt that the human-animal bond is something that's just so unique.
Meredith Dooley, one of the doctors behind a mask, working to untwist a stomach, a condition called a bloat.
It's very painful. It's very painful.
It's also very, very gross. So instead of showing blood and guts, we'll show you the nurse taking notes, the IV drip, another doc quickly going over things in his head, these air vent thingies, his heartbeat, doing fine, and some random chatter.
You like that purple pin, Loretta? That's right, I brought that to the clinic.
And just like that, this guy's got a new lease on life.
This is actually a second career for me.
And speaking of second chances,
My family thought I was absolutely insane.
at the age of 40,
Thank you, ma'am.
Cheryl Agent decided to start over, tackling 4 years of undergrad, then 4 years of vet school.
Hang on, Jack.
She's been practicing now for 2 years.
Yeah, so you can teach an old dog new tricks.
Unless, of course, that old dog happens to be her own, Jack.
He's terrible. He's grumpy. He's old and...
How old is he?
15.
Wow.
Yes, you would, Bunkin.
Dr. Dooley's dog, Sassy, isn't much younger.
She doesn't have any teeth, she can't see, she can't hear, she can hardly walk.
And she's currently getting her temperature checked where the sun don't shine. And Sassy's reaction right there brings up the peculiar challenge of patient communication.
Cats and dogs can't tell us where they hurt.
Whoa, Jack.
They can't tell us exactly what their symptoms are.
Not that that keeps anyone here from trying.
You feel better?
One-sided conversations are not uncommon.
Were you trying to chase something through the barbed wire fence tonight? 1201.
If only the tricky ones, like Bandit here, could actually respond.
He had 10 teeth extracted about 2 to 3 weeks ago.
Poor little guy looks like a dazed Groucho Marx and is doing an involuntary impression of the Leaning Tower of Pisa.
Look at him, it's like the room is at a tilt.
Meanwhile, just a few feet away, an English bulldog named Diesel looks like he's sleeping off a hangover. Tongue hanging out, slobbering jowls, paw dangling off the side.
I guess he went outside, either got a hold of an insect or got a hold of something that he was allergic to and ended up couldn't breathe.
He's doing a lot better now, which unfortunately can't be said for the 3-month-old Pit in the exam room.
I didn't want to see him hurt no more.
Duke has parvo, treatable but too costly for his owner Jack. He's opted to put him down.
I'm sorry, I really don't know what to say right now. I'm going through a lot.
It's okay, kiddo.
Death here is treated with a moving dignity.
I know, baby. There's no parvo in heaven.
As for disposal of the body,
We'll pay for it.
that is courtesy of Virginia and Nedra, complete strangers to Jack, who overheard his situation while in the waiting room.
You need to do a good deed every day.
As for why they're here, that suspicious growl is from Charlie, their 7-week-old cat.
I found him out of the chair and he went to squalling.
Pull this leg.
As Charlie gets sprawled out for an x-ray,
I know it hurts, but I don't know where.
Want to help me draw some blood?
we'll check in with Dr. Agent, who's talking to Bandit's owner.
He was leaning up against the wall for balance.
Chances of a post-complicated bacterial infection are very, very high.
Meanwhile, back with Charlie,
So I'm not seeing any signs of any fractures.
the only thing broken is Miss Morrison's sleep cycle. It's almost 1 in the morning.
Damn cat, I'll probably be forever with that cat.
And on they go, night after night.
but I want a PCV, TP, and 12.
Sewing up a dog who got hung up on a fence.
All closed up.
Saving a puppy nearly sucked dry by ticks. Even fixing a cat's ruptured anal gland.
I know, baby.
Yes, it really is that nasty. How do they do it?
They do it because they love it.
His tail works.
And when they put that much love into what they do,
Is a CPR. Pam, I need you to call this owner.
when tragedy hits,
This is Bandit. This is Bandit. We've got blood in our lungs.
it hits hard. And the loss is palpable in the room.
Sorry, Bandit. Mama tried for you, kiddo. Mama tried.
There's a collective deep sigh. As the phone inevitably rings,
How does his wound look?
as the next case appears,
Holy moly.
Hey, Stoner.
as everyone catches their breath for another day.
Thanks, guys.
Have a good night. Be safe.
Burt Mumolo, News Channel 8.